Hi, I'm Dr. G, and I'm here with Lee and Isis, the running couple, and I'm doing an ART demonstration on Lee's left IT band. So what I'm going to do is, he's in his proper patient position, and I'm going to draw tension on his distal IT band right where it attaches down at the knee, and I'm going to draw tension up towards the hip as I draw his leg across his body, basically shortening up the IT band, drawing tension on it, and lengthening it out. And what this does is allows us to break up the adhesions that develop in between muscle fibers, and they get reabsorbed, and it allows the muscle to reset back to its original position so that it can be more functional. It's a great technique for sports injuries, IT band, patellar tendonitis, Achilles tendonitis, plantar fasciitis. For runners, IT band in particular is a big one, and we just draw this all the way up the length of the muscle, usually going from where it inserts down by the knee all the way up to where it originates up by the hip. So that's one way. We'll work that distal portion again. And so what I'm going to ask you to do is just allow me to extend that knee while I draw tension, just like that. Sometimes there can be a slight level of discomfort associated with some of these maneuvers, but it's nothing that shouldn't be past patient tolerance. Typically, people can notice an immediate difference, especially after a race. Usually, they will have used their IT bands and their hamstrings for anywhere from 50 minutes to two and a half hours. So their IT bands are really getting a lot of work in, and they can notice an immediate difference with 5 to 10 minutes of work being done.
I could feel it instantly after the first one, just the leg actually loosening out.
Okay, so lie on your side facing the couch. This is going to work more the actual muscular portion of the IT. Okay, and I'm just going to extend your hip out. For people that are training for marathons and triathlons, especially the longer distance ones, the half Ironmans, the Ironmans, self-therapy can only go so far when you're putting in 40 to 50 miles a week. Usually there's some level of injury involved. So
How often would you recommend something like this?
it depends on someone's training schedule. If someone's getting injured, say 4 weeks out for a marathon, then it's a good idea to go 2 times a week for those 4 weeks. If they get injured, say 3 weeks out, and it's something that they don't want to push back, it's a good idea to go 3 times a week. That's about the max that you want to do, is 3 times a week. On some people, it can be as infrequent as 1 time every couple of weeks. So, all right, I'm going to work over in the hamstring. So what I want you to do is flex your hip and your knee, and when it gets to about here, you're going to extend your knee out.
Okay.
And I'm going to draw tension on the hamstring muscle up towards the hip joint. So go ahead. Okay. This is another big running injury because it crosses the hip joint and the knee joint, which are the 2 joints that are primarily used extensively during running. This is another one where people tend to get immediate benefit from. It's great for repetitive strain injuries because it helps loosen that muscle up and gets it functioning again. without having to delay any type of training.
So can you use this as a preventative method as well?
Yeah, you can. What we like to do for prevention is focus on, we do a lot of biomechanical analysis at Spring Valley Chiropractic. So for prevention, we like to identify any type of muscular imbalances and give exercises that we feel will strengthen the deficient muscles. And along with doing this, what this is doing is this is lengthening out muscles that are typically too short. One more pass. There you go. Okay. Now get up and walk around some. And there should be quite a noticeable difference.
Yeah, I mean, my left side feels totally different from my right, so feels good.